your mental health and physical health. It also helps you make life choices that can be in your relationships with people, your career, your medical goals, things of that nature, and just really will help you live a more balanced life.
Mm-hmm. Very good. So now, Dr. Briegel, would you like to tell us a little bit about the primary mental health diagnoses among adults with spina bifida?
Well, first we had a request in the chat if Sarah could possibly turn up her volume.
Oh, thank you for checking that.
My pleasure. So on with the show. There's still a lot we don't know about the mental health functioning of people with spina bifida. It's a brave new world. There have been several studies on depression, and there's less data that I found on anxiety. I think it's probably a safe and secure bet to focus primarily on depression and anxiety, since so much of the general population struggles with these things. And I think it's important to talk about how people with spina bifida may sometimes manifest atypical or unexpected signs and symptoms, and that not limited to people with spina bifida, but often probably more common in people with spina bifida, is how either executive functioning can potentially mimic what we might call depression. Oh, here's a demotivated person who's not doing what they should be doing, they must be depressed. It could be that they have an executive functioning problem that makes it harder for them to initiate tasks, even ones that they want to follow through on. It can also go the other way, where when we can't do things that we want to do or we feel are important, we can start to feel demoralized. So I think executive functioning is an important piece of the puzzle. Signs and symptoms of depression may include, but are not limited to, a prolonged period of sadness. We're talking weeks, months, a longer period of time, hopelessness, emotional numbness or flat affect, so not even feeling anything or not expressing outward emotion, feelings of poor self-worth or low self-esteem, lack of motivation and interest, especially in activities you used to enjoy, decreased interest in taking care of yourself, chronic fatigue, rehearsing negative or self-critical thoughts in your head like, I'm garbage, I always screw up, I'm a burden to others, I'm hopeless, I'm helpless, I'm terrible, I'm a bad person, nobody likes me, I'm always going to mess it up, thoughts like those. Self-harm, whether passive or active, and that's essentially hurting yourself intentionally. Suicidal thoughts or actions. Frequent crying or the inability to cry. I remember I saw a presentation at a spina bifida gathering, and the presenter said that people with spina bifida showed decreased tendency to cry outwardly. And when I compared notes with other SB people after that, several folks said, yeah, I do not cry outwardly except perhaps with close friends and family. And it may be even a visceral thing where you're too numb or too tired to even cry, even if you would want to. Depression can also manifest as anger or irritation. A depressed person can have angry outbursts that are disproportionate to the thing that they're getting frustrated with. You might experience increased or decreased appetite compared to where your appetite's normally at, or increased or decreased sleep in a dramatic way.
Okay. And now what about in terms of anxiety?
Okay, signs and symptoms of anxiety may include, but are not limited to, rumination and worrying. So you find yourself replaying past mistakes and upsetting events, or you find yourself imagining future negative outcomes and you have a tendency to catastrophize them. You may engage in certain rituals in order to avoid triggers or negative outcomes. You may go out of your way to avoid triggers, and that can include isolating yourself socially, being reluctant to leave the house, avoiding situations that you fear may trigger you. Particularly if you have PTSD or acute stress disorder, you may have nightmares or flashbacks to a traumatic event. You may, again, experience irritation or anger, and especially when you feel you're being shoved into an anxiety-inducing situation, you fight back and try to resist it. You may experience panic attacks, and the main features of panic attacks include racing heart, dizziness, shortness of breath, nausea, fainting, or feeling like you're about to faint, fear of death and dying, and this urge to fight, flee, freeze, or just flop over and play opossum.
Okay, very good. Thank you. And so are there any physical causes that could provoke anxiety or depression?
Sure. There are the standard ones like neurochemical imbalances that many people struggle with that are just inherent to who they are and their biochemistry. There are also physical problems that can manifest in anyone, like adrenal issues. That happens a lot with people who suddenly find themselves feeling depressed or fatigued. Going to the doctor and investigating adrenal issues is a good hypothesis to explore. And in people with spina bifida, you want to check for or monitor things like hydrocephalus or shunt failure, traumatic brain injury, and you want to factor in the neurological quirks or abnormalities that are actually appear to be somewhat unique to people with spina bifida. And I won't get into those, and they're somewhat out of my wheelhouse, but there has been emerging research showing that people with spina bifida do have a unique neurological structure.
Very interesting. Okay, thank you for that. Now, what about social emotional causes of anxiety and depression?
I'm so glad you asked. Those can include academic or career struggles, which a lot of us have, regardless of who we are. Financial stress, paying for the dailies of life or paying for medical expenses. Health problems or health management, especially as health problems begin to mount and you don't know how to manage them. Frustration at not being normal or not being able to meet normal milestones, looking around and saying, I'm not like other people, and that sometimes that hurts. Encountering barriers due to mobility or incontinence, not getting to do what you want to do because of mobility or incontinence issues. Socio-political turmoil or injustice. Is the current person in office going to take away my health care or roll back my rights as a person with a disability? And that thought can be incredibly demoralizing and anxiety-inducing. Prejudice and discrimination out in the world. Interpersonal conflicts or problems. Fights with friends and family. Feelings of loneliness or isolation. Feeling guilty or ambivalent or awkward about being dependent on or enmeshed with your friends, family, or caretakers. You can get burnt out from struggling navigating bureaucracies. You can, of course, feel demoralized when you can't access medical care or professionals that you need to see. Lack of access to accommodations and supports you need, and lack of access to transportation.
Yeah, that's a lot.
Yep, sorry.
That's a lot.
Guys.
No, thank you.
Full plate.
Full plate. And speaking of plates, I feel like there was a slide with some plates, but we'll get to that later. So now, Kristen, let's jump to you, and then maybe you can talk about what are some ways that you manage all of these different factors that Dr. Briegel talked about.
Sure. As an adolescent, I struggled a lot with feeling like I wasn't normal or I was different. And I found that attending some group therapy with other children my age was really a wonderful way to help with that. As I've gotten older, more of the traditional talk therapy combined with some group therapy has been super helpful, which brings me to like different Facebook groups that are out there. which, and I happen to have started my own, which I'll talk a little bit about more later, but and then some things I do at home myself, meditation, journaling are excellent ways to start my day. I find that when I don't do those things, my attitude, I guess I'll say, is quite different. And exercise, at least 3 times a week, I try to.
It's a good goal.
It definitely increases my energy. I do realize with spina bifida, it can be hard to exercise given our unique urinary tract and other issues that may arise. But as you get older, you can find ways to make that work for you, and I have. So that's how I address my mental health.
Okay, good. And so while we were talking about this, just 2 quick things I wanted to ask you about. One was about your closed Facebook group, and maybe just touch on why you saw the need to do that versus just a non-closed.
Yeah. You know, through starting Spina Beautiful and meeting so many people that have been so encouraging and kind and uplifting every day, I wanted to bring those people together in a support forum to be at each other's fingertips on a daily basis, to reach out, ask questions, ask for support. And I found some other Facebook groups could sometimes be a little lax in that area, and that there'd be some negative feedback sometimes. So this is just my way of, you know, getting my little tribe together, and again, making something work for me.
Okay, very good. No, good point. Thank you. And then in terms of meditation, I wanted to jump back and ask about that. Not meditation, journaling. If it was something that just came naturally or something that you had to work on to be regular about.
No, I think I'm still working on it, to be honest with you. I know it takes time out of your day. It can seem like maybe you don't have something to write about, but that is okay. You know, just to have a journal with you, whether it's in the morning, at night, just to write something down. It's a great way to release thoughts in your mind, and kind of get them out, and then go back. You can go back and address your feelings. And I've just noticed a huge difference, but I definitely need to work on doing that a little more religiously.
Okay, good. All right, thank you for that. So let's jump into Sarah. Tell us what have you found are good ways to address your mental health needs?
So I also do talk therapy. I've had the same therapist for about 2.5 years now, and we've kind of gone back and forth with a regular schedule. I tend to feel like I need therapy a little bit less in the summer. Living in New England, we have pretty long, dreary winters. But so when summer rolls around and the weather's nice, I want to spend my time being outside, and that's a huge boost for my mental health. It took me a while to find the right therapist, and it's definitely not always going to be like you call someone up and you go see them and it's great. Sometimes you have to kind of wade through some water to get to the right person. And it's totally fine to tell someone that you don't think they're a good fit for you. That is perfectly acceptable. And I think a lot of people assume that you can't do that, but you have that power. If it doesn't feel right, that's totally fine. Exercise is really important. I know when I'm active, I feel a lot better. And I know sometimes that's not easy. I'm recovering from ankle surgery right now, and exercise has been tough, but figuring it out. Guided meditations are awesome. I was a little skeptical at first, but if you go on like YouTube or go on the internet somewhere and you can type in a specific type of meditation, even if you look up like post-surgical meditations, there are like healing ones that are specifically geared to that part of your life. And that can be true of like many different things. You can do depression, anxiety, something that'll help you sleep a little better. There's a lot of options. Medications are an option. I mean, I know that part's kind of scary, and that's something to take into consideration and think about and talk about with your therapist, talk about with your other doctors. make sure that you're taking something that doesn't interfere with other medications you might be taking. But it is an option, and it's okay. You know, we're here to try and break down these stigmas of mental health, and talk about how asking for help is perfectly fine. Something else that I volunteered with before was adaptive horseback riding, and that seems to have been a very successful form of therapy for people who like horses and like being outside.
Okay, nice. Thank you. Well, that sounds good. All right, so now, Dr. Briegel, maybe you can tell us some ways to address your mental health needs. And these are some self-care basics. And I'm just going to jump in quickly first and say that I see one of those listed. Someone had just mentioned, someone who's attending just mentioned that one of these points is really important. So yeah, please go ahead and tell us about these self-care basics.
Sure. Well, starting at the base of the pyramid, adequate sleep, nutrition, and just taking care of your body. A lot of basic problems stem from a lack or slacking off in these areas. I have a tendency to slack off in these areas, especially when I get into a workaholic bout. So it's so important to get sleep and proper food, meals, especially if you're noticing that you're feeling a little bit low. I liked the mentioning of the seasons. Many of us do suffer from seasonal affective disorder to some degree or another. So getting a special, I have folks who have that special lamp that allows them to get those nice UV rays, and that can help their mood immensely. Getting enjoyable exercise in, finding an exercise that's a good fit for you, your interests and your abilities, because if you're simply adopting an exercise regimen based on your ideal self or what your friend is into, you're not going to continue it or pursue it for very long. So finding something that's a good fit for you is essential. Mindfulness is a great resource. And mindfulness exercises exist on a fairly broad spectrum, but fundamentally, they're about drawing your awareness to the present moment, your body, and your thoughts. So there are moving meditations that help you to be more aware of your surroundings. There's something called the body scan, where you check in with each part of your body and you become more aware of how it feels. There are exercises where you step back objectively and look at your different thoughts and reactions without getting attached to them. So I highly recommend that people research mindfulness and find maybe an exercise or two that would be good fits for them. Self-expression, art, singing, journaling, something that allows you to express yourself creatively can be really an essential mood booster. Spending time with friends and family, making friends online. The internet is a real place, and many of us have difficulties going out into the world and meeting with people IRL or in person. So don't underestimate the power and significance of online relationships and support groups. Joining a meetup or another special interest group, say around hobbies or something that you care about or political activism. Joining an emotional or therapeutic support group. Can be spina bifida related, can be mental health related, might be related to something else. Taking up a hobby, whether old or new. Asking trustworthy, supportive people around you for help. Volunteering. Breaking, and this is huge, breaking stressful or daunting tasks into smaller pieces. A lot of us have a lot of anxiety around tackling big jobs, especially when we have executive functioning issues. And you often have to eat the elephant one bite at a time. So looking at what you have to do, looking at when it has to be done and saying, okay, I'm going to research the paper on Monday for an hour. I'm going to add citations on Tuesday for an hour. I'm going to write the intro on the next day. I'm going to write the body for an hour the next day, and then I'm going to reward myself. And this can help you to get things done bit by bit, especially if you reward yourself for tackling each chunk in succession. And finally, because I am an introvert, I need time in solitude, and that can be incredibly valuable. I think we often have a tendency to stigmatize solitude, and we worry, okay, where's the tipping point? And there is certainly a tipping point where self-isolation can become pathological, but spending some time alone to reflect on yourself can be incredibly useful and energizing.
Okay, very good. Thank you. Now, here we see Dr. Briegel. Would you like to share with us just, here's the types of options out there in terms of counselors and therapists?
And it would take me an hour in itself to break through each of these. Just know that these are the options that are out there. They have different powers, abilities, strengths. Some can prescribe medications like LPNs, I believe, can prescribe medication. Psychiatrists can prescribe medication, except in 3 unique circumstances, your psychologist cannot prescribe medications. Some folks are better for if you're having a systemic or a family issue. Some, like social workers, are helpful for hooking you up with resources or government assistance. Some people are skilled more with physical health problems. Some are more facile with your emotional and mental health problems. So doing your research and saying, okay, what are my particular needs as an individual? What am I seeking through these services? And in a moment, we'll get into what I think are the core ingredients when you seek services.
Okay, very good.
I think it is really important for people to know that there are people out there that won't just try to prescribe you medication. I think that is a big issue for a lot of people. They won't go because they just think they're going to have pills thrown at them.
Right.
So there's this whole list. There's a ton of these people that can't even do that.
There's a whole list of people who can't even do that, and every provider is an individual. So there are providers who, on a broad spectrum, are gung-ho for medication, and there are people who are medication shy and will explore other hypotheses first. So you can't really judge an individual based on your stereotypes of their whole profession.
And actually, thank you so much for bringing this up, because actually one of our questions, gentleman was asking about his girlfriend, and he's wondering if there's a way to get her to think about seeing a therapist to help her with her anxiety and depression. She does have spina bifida. And she mentions, or her concern is just what you mentioned in terms of being hesitant that a professional is just going to throw medication at her. And so like you raise a good point that not everybody can even prescribe medication. So it depends on the kind of person.
In the grand scheme of things, so medication is a tool. It's like a wrench. There are some jobs that absolutely require a wrench, and some where if you hit something with a wrench, you're going to make it worse. So I think a really conscientious, good provider will look at the tools in the toolbox and find the tool or combination of tools that are right for you. And it will typically be a combination, not any one thing. There is rarely any one quick fix for especially the types of problems that we're describing here. And I don't think you have to be ashamed of needing medication if that is the tool that you need, any more than you need to be ashamed of needing leg braces or needing a wheelchair. It's what you need to access the world and to feel good.
Okay, very good. And then what about, how would the 3 of you, or just a couple of you, or whatever you prefer, respond to this notion of what could be done to get someone to think about getting therapy to help with their depression or anxiety?
Here's a thought. I think first thought is that because providers are all different and they're all individuals, you may have to kiss a lot of frogs before you find your prince. And if you set up an intake or a first meeting, that's like a blind date and you are not committed. So you can certainly check out a provider if they say, well, I'm going to throw this bottle of pills at you because that's my hang up. You don't have to see that person again, hopefully. So don't be afraid to investigate, meet someone, see if they're a good fit, and you may be surprised at what you find, especially if you're willing to investigate multiple people and searching for your prince, princess, non-binary monarch in frog form.
Okay, very good. All right then. So
all you can do is be as encouraging, as you can with your girlfriend and encouraging her to seek help. She's probably become her own advocate for her physical health with spina bifida. I don't, why not encourage her to treat her mind the same way? I know it can be frustrating, but sometimes you do need medication. It's been described to me as it can sometimes be a chemical imbalance in your brain. You literally need to fix it with medicine, just like you'd fix a kidney infection with medicine. So, and sometimes you don't. So just keep cracking at it, and I wish you luck.
Yep.
thank you, Kristen. And Sarah, did you have any thoughts on that, on the question about, how do you get someone to consider addressing or seeing a therapist?
I just agree with being really supportive. I know personally, I don't like being told what to do. And when people tell me what to do, it makes me not want to do it.
Right.
And I think that therapy is such a sensitive subject that it needs to be more of a, hey, wouldn't it be cool if you didn't, feel so bad about this one topic? Or wouldn't it be great if, this weight was lifted off your shoulders? Not like, hey, you need to go to therapy, because I'm sure
Right.
that's not very well received for a lot of people. Yeah.
Okay.
And therapy is a wonderful resource, so you don't have to say only the severely ill see a therapist. Many people see therapists because they see the therapist as a shoulder to cry on, a support, a fellow brainstormer, someone that you just can talk to who is there for you and is there to help you. So see them as an asset.
Okay, that's a really great way a fellow brainstormer even. That's a good way to put it as well.
Let me tell you one more thing really quick. When you make progress with your therapist and when you have, what I guess they would call like a breakthrough, when you realize why you're feeling a certain way about something, it is like the skies have parted and there's sunshine. It feels really, really good. So those little moments are the best.
Good. Excellent. Thank you. All right. So now we have a list of popular types of therapies. Would you like to go, just in the interest of time, and just in case we have other questions, were you just going to review these as well, Dr. Briegel?
Oh, yeah. Oh, God. I would not want to review every one of these because that would be a presentation unto itself.
Yes.
Again, like we said before, or like I've said previously, doing your own homework, because many of these match well with certain personalities, depending on your personality type, your style of learning, your style of processing, and also are more efficacious or effective with certain mental health issues. CBT is very typically analytical, rational, good for unpacking depression, anxiety, and negative self-talk, and typically involves written homework. If that sounds interesting to you, you might like CBT. If you're dealing with addiction or trauma, and you aren't quite sure how you want to necessarily process traumatic feelings or experiences in your past, EMDR might be a good match for you. So investigating, what do I need, what do I want, what fits with me, and which of these are empirically validated or proven to work with certain issues.
Okay, very good. But this is so helpful just to see that there are so many different types of therapies and options out there. So now what about, and this is, I think you might have touched on this a little bit, but I think it's really good to reiterate, what are the factors, the main factors to consider when you are choosing a therapy or therapists?
Unfortunately, keeping it real, what your insurance will approve or pay for may constrict your options. From there, I think you investigate the therapist's experience and their specialty areas. Many people will go to Google and they'll search trauma plus depression or the issue that they're dealing with, and you might include disability or spina bifida or disability issues in your search and try to find a therapist who is disability friendly or savvy. I think one of the most important factors, if not the most important factor, is rapport or fit. Fundamentally, do you like and respect each other and get along well? I think personally, you can see the world expert in a given issue or problem, and if you don't feel comfortable and safe with them, you're not going to make as much progress as you will with someone who may be slightly less familiar with your issue, willing to learn, that's important, and willing to continue to work with you on your wavelength. So fit is very important.
Okay. And now, would you like to share with us a little bit of a few of your go-to resources when it comes to mental health?
First, huge shocking surprise, I'm going to promote my own website because I've compiled a resource list that is constantly under construction. So I'm constantly updating, and I welcome other resources that people find helpful so that I can add them as well. Mind Over Mood is a great CBT workbook that I love. Freedom from Your Inner Critic is based on a model called Internal Family Systems. And if you have an inner critic, you may find that book helpful. The Bloggess is a hilarious woman who struggles with multiple physical and mental health issues and writes about her daily life in this really enlivening, enjoyable way. Captain Awkward is an advice blog that I think provides wonderful scripts for dealing with toxic or conflictual relationships. Andrea Lausel is a Latina YouTuber with spina bifida who covers different disability and spina bifida related issues. Shine is an organization in the UK that has a great website with different resources. And NAMI is a resource primarily for caretakers and loved ones of people with mental illnesses. And they have a huge network of different resources, helplines, and a huge body of information, as well as different types of support groups and gathering groups for people with mental health issues.
Okay, very good. Thank you very much for that. And now, Kristen, tell us, please, your go-to resources, such as your private Facebook group, sorry.
Yeah, I kind of mentioned that earlier. So there's lots of Facebook groups out there. Again, some can be really great and some might not feel like a good fit, just like everything else we've discussed today. So, to make it work for me, I've created my own group with sort of my SB tribe. I also have found in the past that my local hospitals usually have weekly or usually monthly support groups. And there's all kinds of different topics. They're always free to attend. So that's been wonderful help to me. My local Spina Bifida Association chapter has had monthly adult get-together dinners, which is awesome. It's another great way to be part of a group of people that are your age and going through the same thing. And then I listed some apps that I have on my cell phone, actually. These are geared more towards mindfulness and meditation. They have been a great way for me to step away from a stressor for a second, just give myself a quick scan and realign myself with my intentions for the day, and making sure I'm respecting my thoughts and myself as I go through maybe something difficult, or if I just need a quick pick-me-up. And as I mentioned earlier, journaling has been another wonderful tool to just release, what's going on in my mind sometimes.
Very good. Yeah. Thank you.
Yeah.
Oh, and here's your fun list of books.
My books, yeah. So sorry for the bad words in here, but it is an awesome book. Most of these books are, again, geared towards mindfulness, meditation, spirituality. I found that my biggest thing to tackle with my own mental health is all the negative talk that I have sometimes going on in my mind. I'm not good enough. I'm not smart enough. I'll be too sick. I'll be too whatever, I'm not perfect. But who is? And these books make me remember that no one is perfect, that I'm fine just the way I am, and that I should reach for my goals regardless of anything. Well, that's
okay. Very good. Well, thank you. And now, Sarah, what about yours?
Yeah, I wanted to give Kristen's blog a little shout out.
Thanks.
I really like reading it. Her latest entry is awesome. Talks all about her pregnancy in a super honest way, which was great. I think the best thing about it is that it's so positive. It really puts having spina bifida in such a positive light. Yes, we have all these issues, but we're all in it together, and we've all accomplished really cool things because of it. Yeah. So it's nice to have that perspective. Guided meditations on YouTube, like I mentioned earlier. You can probably find one for anything you are going through. I really believe that. I've definitely had ones that will help me sleep. I used a couple after my last surgery to feel a little better. There's so many options out there. Journaling and making lists is really helpful. I actually had to do this yesterday because I started getting really stressed out about all the things I have to do this week. So I wrote everything in a list, and as soon as you cross one thing out, you start to feel better and better. I think it's a very simple thing, but it's something we kind of neglect to do. Life gets really, really overwhelming sometimes, and it all gets jumbled up in your head. So if you list it all out, everything seems manageable. You can go about it in a very specific way, and that just always helps me feel better.
Okay, great. So thank you very much for presenting all that wonderful information. And now I thought we could bounce back to a couple of questions that some folks had. We had one question that I might need some clarification on about wondering if how people can balance getting out of the house and maintaining relationships online. So maybe a balance of the two, how you can do that is, and I'm just gonna have to go in here and just, if you can see this, I apologize. Let's see, I'm gonna jump in and see if I can see this question. Okay, all right, so that was the question. How do you balance being able to go do things outside and have your online relationships? Do the panelists have any thoughts on that?
I think that it is very important to set boundaries for yourself. And this is something I see definitely not just in the Spina Bifida community, but in a lot of different communities. We're always on our phones, we're always on our computers. It seems very easy to maintain those kind of relationships where you just have to send someone a message or comment on their photo or something. But setting those boundaries, if it's something that really is a problem for you, saying, hey, I have an hour on my computer tonight. I have an hour to scroll through Instagram, or whatever time limit works for you. I think that is very important.
Okay, very good. Thank you. Did Kristen and Dr. Briegel, did you have any thoughts on that?
I'll let Kristen go first.
Okay.
You know, I think, like Sarah said, it's really important to not to enjoy the fresh air for sure. Everybody's priorities are a little bit different. I wouldn't judge someone for not, you know, going out as much as maybe I would. But I do think it's important to disconnect from social media and your computer and your phone and just live in the moment. Again, practicing that mindfulness thing I was talking about has been of a huge benefit to me, and might be of a benefit to someone like that.
Okay, great. Thank you.
And I had thoughts as well. I was just writing back in the chat. So some people benefit from having reminder apps that tell them to do something or to stop doing something. Some people find it helpful to even have apps that shut off the Wi-Fi or that prevent them from using time-wasting programs when they need to work. If that's what you need to do, do it. I think rewarding yourself, so either setting a rewarding activity that you're going to enjoy, or rewarding yourself for having done something that might have required a little bit of effort or push on your part. And imagining yourself enjoying the activity that you want to partake in to motivate yourself. I think we all motivate ourselves differently, but I consistently find, and the research has consistently found, that self-compassion is powerful. So instead of yelling at yourself for failing at your goals or not being better, treat yourself like your own best friend and saying, how would I inspire, motivate, and encourage somebody I cared about? I typically wouldn't berate them, shame them, insult them, or yell at them. I'd say, hey, better luck next time, or hey, you made a little bit of progress. I think you can use online groups to schedule live meets, perhaps with the people that you're friends with online. I have done that, and that allows me to internet with the real world. I think setting goals for yourself and then getting straight in your own mind, why do you want that? Why do you want to achieve that? Because if it's salient to you, and the research in self-determination theory has found this, that if you name a goal that is congruent with your values and wants, you're more likely to hold on to that goal and pursue it. And when you find your energy waning, you say, I want this because I will benefit in this way and it's congruent with my values. So setting a goal and getting right in your own mind how it's congruent with what you want and believe. And I think seeking the benefits of the computer in the outside world. So what do I enjoy about the computer? Why am I gravitating towards it? And can I replicate that in the real world somehow? Or is there a vacuum in my life that I can fill with something else besides social media, for example, if that's helpful?
Mm-hmm. Okay. All right. Thank you very much for that. So we have about 5 more minutes, and somebody asked if there was going to be a way to review this and watch it at their own pace. And yes, the answer is yes. An archived recording and also this list of resources will be available not immediately after this webinar, maybe give it a day. Under spinabifidassociation.org/education/SBU. The archive will be there. And somebody else had also asked about one of our previous webinars on exercise or getting active, and that webinar is listed there as well as the list of resources as well. So I wanted to say that, and then somebody else just asked for the name of Kristen's Facebook group.
Oh yeah, I'd be happy to share. It's Spina-Beautiful Support Forum. So you should be able to just type that in the search engine on Facebook and it will pop up. It says Spina Beautiful with my picture. I'd be happy to have you. I'd be happy to have any of you there.
And if you joined the webinar, you know what Kristen looks like. Very good. So I had one quick question also, going back to finding that getting that right fit with a therapist. so thinking about Sarah and Kristen, did you immediately find a therapist that you just hit it off with, or did it, was that a little bit of a process for you?
Kristen, you can go first.
Okay. I, as a child, was taken to a therapist probably from the suggestion of a doctor one time and never brought back because it was so strange to me at that age. So that, I guess, maybe put a little bit of a negative taste in my mouth as I got older. But more recently had the suggestion of my doctor while going through my pregnancy, because it's making me a little nervous, to see someone for my mental health through this journey. And I actually just got the suggestion from someone at work who's been very open about her attending meetings with a therapist regularly, and how wonderful it's been in her life. And so that was the best way for me to find someone that seems like a really good fit. So I think I got lucky, but that's usually how I find doctors in general, is asking questions, not being shy about what I'm going through, so that I can reach out to people and get guidance and recommendations from either the Spina Bifida community or friends, family, to help guide me.
Okay, very good. Thank you. And before, Sarah, before you go, the person would like you to please repeat the name of that Facebook group.
It's Spina-Beautiful Support Forum.
Okay, so Spina dash.
I'll write it in the messages.
Oh, you'll write it. Thank you so much. Okay, cool. And then, so Sarah, just quickly, from your perspective, was it an immediate fit?
No, I actually had the same experience as Kristen did when I was a kid. Kind of got put in therapy just because, and it left a really sour taste in my mouth. So I finally realized I was ready a few years ago, and I did a lot of research, and I made phone calls and kind of spoke to a few different people before I found one that was the right fit for me. Okay.
Very good.
Well, I've had a therapist, so therapists can absolutely have therapists.
You have a therapist too?
Yes, I have in the past.
Okay.
And I was initially very nervous, and even therapists can have baggage around going to therapy, which I did, and I had to work through. And my therapist was absolutely wonderful and got me through a very difficult period in my life.
Oh, wow. That's great. And then was this the first time, like, was that the first time that you saw someone, or did it take a little while to?
I was referred to the school counselor also as a weird kiddo, and did not enjoy that experience because it was under duress.
Okay, yeah, it sounds like that's a common theme. It's like if it's something that you don't want to do, if you're not there yet. Sarah mentioned, just being ready for it a couple of years ago, later on as an adult, that it really has to be in your own terms.
It really does. And can I have a last shout out?
Yes.
I would love to shout out to my friend Monica, who referred me to this webcast. She's an awesome nurse with Spina Bifida who knows her stuff. I appreciate her, and I appreciate her for getting me in touch with y'all. And a shout out to Joel, who doesn't even have Spina Bifida, but came to sit in the audience and cheer me on. I appreciate both of you guys.
That's awesome.
And so do I. This is Juanita, and I would also like to give a shout out to Monica, because if it weren't for Monica, we wouldn't have had you.
Yeah.
Lord, Monica.
So thank you so much. And so if anybody has any questions, please feel free to direct them to either one of us, to Judy Thibodeau, who's the Spina Bifida Association's Director of Research and Services, or to me, and our email addresses are listed there. If you have any questions about that, and then you'll also be getting a follow-up email, like I said, with a little survey monkey, so that you can evaluate the webinar and then help us in our future webinars to improve. And if you have any other questions, yeah, just send me a note. And then check also to our social media pages, probably the same way that you found out about this event. We will share information about accessing the recording and then the resources that you saw today. So thank you so much to everybody. Thank you so much to our panelists. You ladies were awesome. And have a nice rest of the afternoon, or yes, afternoon. I think everybody in the United States is in the afternoon. So, all right, well, take care. Thanks a lot.
Thank you.
Thanks.
Bye-bye.
Bye, everyone.